Hello, how are you today? We're going to talk about dentists and technicians. Have you ever met the person who actually create your denture? Have you ever met the person or being introduced to you? In this video today, we're going to talk about the technicians and dentists. Dentists and dental technicians. Without each other, it is a little bit hard to work. Dentists without technician doesn't make that much money. I'm gonna talk about the differences between both. First, let's start with the dentist. So dentist is the professional, is the prescriber. He prescribes the medical prescription for the patient, which whether they require extractions or any type of illness or anything that is going on in their mouth. So he prescribes whatever, either crown, bridge, or tooth extraction, or any type of work that person is needing. So the dentists from the 80s, probably 70s, 90s, there was a slightly difference in each one of them. So back in the days, I think most dentists was able to be complete, which is they know how to do everything in a dental office, starting with cleaning teeth, assist making teeth, making dentures, anything. They more fully complete, and in many countries, they still do that. You know, a lot of countries out there, Central America, South Asia, Europe, dentists still are able to make their own dental prosthetics. They still have that knowledge of the prosthetic in the laboratory part of it. So same way with the dentists from the 90s. A lot of them, they have a lot of knowledge of what it is done in the dental lab. But today, a lot of dentists of today, sorry guys, you don't know much. You don't. And they played the rule as, well, the degree that they have is above what a dental technician has, and they tend to use technicalities back into their curriculum to shut technician down. That's pretty much. So, but when it comes to a dental prosthetics, which is removable, and a lot of them don't know anything, because now universities, they only have one semester of lab where they kind of have that general education about what the laboratory do. In my own experience, I have had thoughts, a lot of troubleshooting to dentists. I have thoughts troubleshooting to a lot of dentists, which is they just come to me and ask me questions about, hey, how to do this, what to do in this situation, you know, in my own experience. So not many dentists know about this. When patient comes, they know how to take the impressions. They know all the basic procedures um, about what's going on and what it needs to be done for the patient. And the sad part of it is that they don't give that credit. They take the credit from the tech. The technicians are the people behind the table, behind it, just like the musician that play the guitar for any famous artist that is performing. Those are the technician, just like the medical labs in the laboratory, looking for what's going on with the patient. Same way with the nurses, for the specialists, for the doctors in the hospital. Have you ever met the person who actually made your teeth? Have you ever been invited to come over the laboratory and say, this is the person who actually made your denture? They use the proper terminology. Okay, I actually can change this for you. Actually can make the teeth move from here to there, short it up a little bit, and then okay, you want more smile and you want a little bit more bulk, I can do that for you. Really? Do you really do it? No, it's not the dentist, it is the tech. Why not use the word and say, actually, I can probably tell the technician to move this from here, to the left, to the right. Get rid of this bulkiness on here. Can they use that terminology, as a second person? So they use I can, but it's not them. It's the technician who does everything. They send that out to the local lab or to the lab in the side and tells the technician what exactly needs to be done. But as obviously he has some type of a by registration where a technician can duplicate that in the model, whether there is an open bite, there is a too close end on end, etc. Technician knows how to fix all these problems. So, well, there is many kind of technicians. The one that worships the dentist, they always kind of I guess down themselves just because their education was not enough. I guess they didn't go to college or they just learned on the side. And well, there is others that they can dispute anything. There is some in other state they call them denturists. Also, sometimes they consider they're better than anybody just because that certification of a kind of recognition for their accomplishment and few month courses on learning how to make how to do impressions. Maybe a year or 6 or 12 month of education to learn how, and then few hours of batch testing and certification. Being a technician is like being an artist. You create and you get test out. If I will hire a technician, I will tell me what you. I'm not gonna ask him for his certification or how much education they have. I will say, show me what you got. Here is the bench. You got 2 hours to accomplish what I need you to accomplish. and then he has to perform in a timely manner, because in the laboratories everything is timed. In order for me to hire that technician, you have to do high quality of work, and I don't care about your certificate. I don't mind that you're a dental certified CDT. In my own opinion, is for me just something to have the bragging right, to have the respect, I guess. Uh, but for me, it's just I will have to see your work in order to back it up for me, your certification. So that's the difference sometimes on the field. But technology is going to a whole different era, throughout the years. There is a lot of technology involved. There is a lot of computerized things involved. I believe in probably not even 20, 25 years, anybody can make their own denture. Because there is that 3D dentures going on that some places are using that technology. There is so many other cap can dentures. Everything is digitized nowadays, where actually technicians, they're not gonna be needed. And a lot, even now, there is a shortage of technicians. There is a shortage of a dental technician everywhere. A lot of dentists, they ordering their products from elsewhere, and then more when that technology comes around, which right now is still expensive, but the technology evolved throughout time. The evolution of a technology will come to anybody's home, which is you can just buy that 3D printer and tell your daughter, can you print me a denture, please? Can you? And that's it. Then she's gonna be just in 2 hours. You got it. Upper and lower, print. When that technology comes around, there won't be no need for going to the dentist to get a dentures. Everyone should be able to just print their denture, print their partial, print their crown. Just take the crown with you and take it to the dentist. Can you glue that for me, please? Cement, glue it up for me. I made it yesterday. I don't know. When your printer is broken, you can say, well, I just gonna have to go. You already have the file with you. You already saved it in the USB port. Take it with you, and I have the file here. I have it with me. It's already ready to go. Can you print it for me and cement? That's how it's gonna be. Technology now. That's why he's heading. Or later you can just take a picture of your mouth and this is how I want it, and then selfie it all out and just print it. That will be able to create your own prosthetics, and that's where the technology, I think, that's where it's going. There won't be that much need for dental techs, but they probably will still may have a job because the charges. Some laboratories still maybe survive by making dentures in any way. Everywhere human beings are creative, there's always gonna be way of a technician to find the way to do their work. So anyway, thank you for watching. Don't forget to subscribe so you can get more videos from this channel. And also every single week I will be uploading new videos, and don't forget to subscribe. Thank you.